Hello and greetings from your state capital here in Jefferson City. I'm State Representative Tim Jones and I'm speaking to you from the back of the House chamber. We have just finished the first half of the legislative session and we will be going on a week-long break and returning the week after that to finish up the remaining 8 weeks of session. I will be going back home to my family and my law practice and pretty much working during the break and also visiting constituents and many of you around the district. This week was a very exciting week and we moved a very important piece of legislation that I have discussed many times in many of my reports to you, which is the Missouri Healthcare Freedom Act. I am the proud sponsor of the joint resolution here in the House, and if it passes the House and the Senate, this will be a proposed constitutional amendment that you, the Missouri citizen and voter, will have the opportunity to vote on in the fall. What the proposal is, it's based upon the what has been going on in Washington, D.C. over the last 14 months and the lack of attention that has been paid to your opinions on this issue. The current federal plans have an insurance mandate in them that would force you, your families, and your small businesses to purchase an insurance product that the government will decide that you need to purchase. It will remove your rights of freedom and liberty in making your own personal healthcare choices for you and your family. The Missouri Healthcare Freedom Act would amend our Constitution and provide us protections from such a heavy-handed federal takeover of our healthcare system. It will also protect us from the penalties and fines that could be levied against us if we do not go with the government plan. The government plan has been heavily criticized by all angles of the political spectrum. There are Democrats and Republicans across the nation who are asking President Obama and Pelosi and Reid to stop going down this path they have charted. Unfortunately, they're not listening to the American people. So now it is up to the states to stand up and say, hands off my health care choices. There are 36 states in the union that are doing what Missouri is doing in this matter. So this week we had a 4.5-hour debate on the Healthcare Freedom Act, but in the end I am very proud to report that we perfected the bill by an overwhelming bipartisan vote of 113 to 40. We will have one more vote on the bill after our break, and then hopefully the measure will be off to the Senate where they will debate it over there. Because the federal government and those in Congress have refused to listen to you, the Missouri voter, the Missouri citizen, the Missouri constituent, we are listening to you here in Jefferson City. Thank you again for viewing this report, and I look forward to speaking to you again in the near future from your state capital.